52 people have now died from the flu in this state, and more people are being diagnosed every day.
As you can imagine, there's a dwindling supply now of flu tests and vaccines because of all the demand. And News 8 medical reporter Jocelyn Mementa now with how one area primary care center is dealing with that.
It's down to this meager supply of the flu vaccine at Stratford Medicine with St. Vincent's Medical Center. Fortunately, the demand has not been as high as in previous weeks.
The last few weeks, it's been almost what I call an avalanche of people calling and coming in with what they suspect might be a flu-like symptom.
Internist Dr. Charles Bruce-Tagoe says more flu shots are on the way, which has already been restocked twice since the initial order back in the fall.
We have about 80% coverage in vaccination. There are some who are adamant about not getting the vaccines. So for them, we tell them if there's the slightest sign of illness, come and see us.
The flu test also reordered with just a handful left for patients. So they're being judicious about it if someone wants to be swabbed for it.
We've taken their history, examined them appropriately, and reassured them they didn't have the flu, and therefore they didn't need to have the test, so we don't waste the testing.
Shannon? Yes. Hi.
The flu was tough on Shannon Sopp's family. Two of her loved ones came down with it. She and her daughter managed to avoid it.
We were able to not come across the flu, then using Lysol and bleach cleanup like crazy.
How bad was it?
It was pretty bad. It was pretty bad. The coughing and sleepless nights and high fevers, it was bad.
Meantime, it's not too late to get the vaccine and keep washing those hands.
This week hasn't been as bad as the couple of weeks prior. It's gone down a bit, but we're still seeing a few with a lot of questions because we're not out of the woods yet.
In Stratford, Jocelyn Mementa, News 8.